I have no emergency plan in place for my father. I do appreciate these things that help me avoid some kind of catastrophe. Sourcewise, it's good to feel like there's somebody who cares about what's happening to me.
And agencies on aging like Sourcewise, sometimes, and this is not a good thing, we're typically like a best kept secret. You don't really know until you're in it. And then you're fumbling through until you find Sourcewise. And then you're like, wow, I wish I would have started here. But at that point, you've already spoken to like 7 different organizations and you're just fed up with sharing your story.
We've just heard from Jennifer Blalock, a caregiver, and Elizabeth Rodriguez, the Senior Director of Operations at Sourcewise, an agency on aging in Santa Clara, California, both of whom help us to understand this best kept secret in today's episode. Before we get started, a couple of numbers reflecting the senior population in the United States that are pretty staggering. Every day, 11,000 Americans turn 65. The average monthly Social Security check is less than $1,900, and half of Americans have less than $10,000 saved for their retirement. Assisted living facilities cost more than that each month. So, is aging in place the answer? It certainly seems so, and most families are in favor of that option, but they often underestimate the personal costs, the time, money, and stress to make that happen. I'll tell you from my own personal experience, recently taking on the shared responsibility of caring for my mother in law after a stroke with my husband and brother and sister in law, that while the preference is to age in place and stay at home, we're dealing with a situation where there's no long term care insurance. There is savings, but not enough to cover the real needs that we're dealing with following a stroke and cognitive and physical decline and daily functioning of supporting daily living and support needs. These are the issues related to caregiving for a loved one and keeping them at home. And this episode focuses on transforming America's senior care crisis and supporting those caregivers. There are times in the world and in life when a discovery changes how we do things. Hi, I'm Shelley Schoenfeld. Join me and my podcast partner, behavioral technologist Bob Gold, on this journey of discovery as we unfold a whole person health delivery science for people in need. Welcome to Human Resilience, changing the way healthcare is delivered. In this episode on caregivers, specifically those where elder care needs, we go to Silicon Valley to meet the Sourcewise team, which services more than 100,000 people in Southern California. First, let's hear more from Jennifer.
Originally, I'm from South Africa, but I've been in the United States for a very long time now. It was easy for me to settle in California, partly because it's very much like the Cape. I became a citizen in 1986 and I'm married to an American, and I've managed to hold my marriage together through all kinds of thick and thin, including providing care to my parents. My mother had a massive subdural hematoma. She was in intensive care, for 2 or 3 weeks. And ultimately, she turned out to have some anomalies or abnormal behaviors given the damage that she had incurred. But being who she was craned into a bed after she was discharged from hospital. And 6 weeks later, she left walking. I actually was part of her care program then, but they lived in Florida and I was working full time. So the care that I provided was sometimes remote. And I'll tell you, it would have been very helpful for me to have had a Sourcewise when I was trying to find services for my mom.
My name is Annalisa Del Canal. I'm the CEO of Sourcewise. We are the area agency on aging in Santa Clara County. And simply put, we help people age well. We provide programs and services that allow them to be independent in their home and the community of their choice for as long as possible. I've been at Sourcewise for 10 years now. What I'm most proud of is just the values that we've instilled, how we responded to COVID, how we've been able to take those lessons, and really just envision a future where older adults and persons with disabilities are celebrated in our society. Folks tend to find us mostly when they need us, when they're in a crisis point. But I think one of the things that we've learned about COVID is that anything can happen at any time. And so we are focused on doing more outreach, engaging folks, making sure that they know we are here.
The SourceWise program is truly unique because it applies our behavioral RX science of engagement to customize the experience for each participant. And how we do that is we get feedback from participants throughout the program. So we're delivering on the needs that they express in that moment. If their needs change, we can pivot in the moment to deliver what they're needing right then and there. Coming up, you'll hear from Elizabeth on how the science of personalized engagement creates a resource for caregivers that delivers to each person's specific needs.
I'm from California. I now live in the Bay Area. I have 2 children. I am a T-ball coach and spend my days running around from sunup to sundown. I have been in the aging field since 2014 and first started out working in a nonprofit supporting with fall prevention, medication management, etc. And I've been with Sourcewise now since 2015. I've been here in different capacities, working frontline, supporting our clients, next supporting our grantees and all of our contracts, as well as our Caregivers Network program.
So tell us operationally, maybe pre my plan, how you interacted and engaged with caregivers. And then let's say when you added my plan, what did that mean in terms of engagement and changing the way that the case managers interacted?
My plan is an innovative technology solution or interface that assists our caregivers with engaging with our team at any time during the day. Pre my plan, our caregivers network would engage primarily with the caregivers either by phone or maybe email. We would go to the home, visit with the caregiver and the individual that they provide care for, talk through potential solutions, take all of that information back with us to the office, develop a care plan, either return to their home and or communicate via the telephone, and then on a monthly basis have a touch point either initiated by our team over the phone and or the caregiver calling us because they need additional support or have an update. And if they were interested in receiving respite, we would then work to identify a third party in-home care agency that may be able to support them and or a private caregiver, and then go through the process of getting the documents ready. Then here comes my plan and the idea that the caregiving population in the sandwich generation was emerging. And we're finding that it's not only a spouse or a wife caring for their husband or their partner, but now it is their child caring for both of them because maybe mom had an accident and was the primary caregiver of their father. And now the daughter is caring for both of them. We were realizing because we're open Monday through Friday, 8 a.m. to 5 p.m., the sandwich generation cannot connect with us at that time. We take lunch at the same time they do. So we were experiencing some barriers with increasing access. And based on our data, we're seeing that we're not serving the most people that we can. And we need to figure out a way to be able to be accessible and to reach our caregivers because their lives are very busy. The 8 to 5 doesn't work. And then we met Gomo.
First, describe at a high level what my plan is, and then maybe we'll get into how it's impacted some of the specific scaling or operational things, like there's a to-do list, and we'll get into some of the specifics that I think were helpful to scale.
My plan's design and technologies is individualized by the user, and it is an online web-based application that caregivers can access at any time of day and is accessible just using their mobile telephone number. So they don't have to remember another login and password for another portal or login, which is a pain. Once they complete the enrollment form, it is individualized based on what they identified as their needs, as well as the individual they're caring for, their needs. It also offers SMS or text messaging for the caregiver to access our caregivers network, case managers, and our team at any time of day during our open hours during the week. They can receive a response within that day typically, but no more than 24 hours. They'll receive a text message from a live person. And if they do reach us after hours, we do have automated text to let them know that if and when somebody's in the office, they will respond back. In addition to that, there's the behavioral RX factor, which we have reward activities, rewarding messages being sent to support them based again on the information they identified in their enrollment form to the program. If they're stressed out or overwhelmed or don't feel that they have enough self-care. Remember, you can access these resources on your portal through My Plan.
Here's what one of the things I think I use is basically I'm served a number of artifacts that relate to my well being. What do I want to do to alleviate stress? And am I interested, for instance, in meditation? And there's an article there about rethinking old patterns, which of course that's the power, right? I can't really change my situation, and I don't want to change who I am, but things that help me cope with my situation and help me change my mindset are important to me.
And then our caregivers network case managers can see what they've taken a look at, what their interests have been, what type of resources they've been looking into. The technology that My Plan supports our team with ensures that we have continued communication and engagement with our caregivers, of which most times they need. And then it offers escalation and alerts. Let's say on the PHQ-2, which is measuring depression of the caregiver and their mental health. Let's say they score very high. We receive an alert once that enrollment form is submitted, and our supervisor then will contact the caregiver to ensure that we can field this urgent request and get them access to support immediately. And then the KPI dashboard, right? We have a dashboard that helps us measure our impact and how My Plan is really supporting us.
For the life of a caregiver and helping manage their life, it's very useful. The other interesting thing we found, it's non-judgmental and available. So sometimes it's difficult for any human to tell another human, i.e., I'm a caregiver. I tell a case manager I'm depressed or stressed. Sometimes they don't want to say it. They don't feel comfortable. They may feel there's a stigma, but saying it in My Plan, and then that goes to the case manager who, when they do talk to them, could address it. There's also more data and information for the case manager to be able to help the folks in a very transparent way. Let's talk a little bit about the day in the life, operationally, functionally, from enjoy and practice for your case management team. How has it helped their day in life service their cases better, enable them to scale and feel better about being able to respond than just when you describe the past telephonically?
My Plan has supported operationally our team to reduce the administrative burden. But when you get into the nuances of case management, there is a lot of back and forth sometimes just through the traditional modalities like phone and email, where there's lapse in time that is really valuable in making sure that we can share information. My Plan has enabled us to communicate quickly with our caregivers, either through text message and or through sharing access to resources via the portal through a few easy clicks. And then it's also enabled us to continue to have that engagement with them on an ongoing basis and really give the caregivers more power to initiate contact with our team and or share feedback through some of the automated text messages that are sent throughout the course of their engagement time. So at least through the first 6 months. Are you receiving the support you need? Do you need anything right now? And through those few text messages, we have received feedback. Yes, I need help, or no, I'm okay right now. I was able to look at this or that on my plan. Thank you for that resource. Or even when we send the scheduled behavioral RX messages that we've received, like, hey, this really helped me today. I was having a really terrible day. So we've been able to engage and continue to get a pulse check on our caregivers throughout our interaction. It has enabled us to identify their needs through the completion of their enrollment form, whether it be respite, case management, the both, and or Medicare counseling.
Let's talk a little bit about maybe some of the components of my plan. I know there's a my caregiver resource library, right? And then you have a caregiver to-do list. What do they do for both the caregiver and your case managers, and how does that help with follow-up and interactions?
Through the My Plan portal and the companion is what we call it. Based on their responses to the intake or enrollment form, there's questions about transportation, there's questions about stress, number of falls potentially that a person's had and that they care for in the past 3 months, their need for respite, etc. Based on those answers, then the portal or companion will populate a list of customized referrals based on those answers that they provided so that they may access those resources through their to-do list at any time. And it is a starting point for them just based on what they shared initially. Then, once the case managers had the opportunity to complete our formal assessment and have a one on one conversation in person or virtually, there may be other unmet needs identified. Our care managers can then assign additional resources and referrals through the companion via the to-do list to that caregiver and then highlight via a text message like, hey, I added this to your companion, check it out when you get a chance. I'll talk to you again next week, but always feel like you can reach out when you need to.
That doesn't then just rely on the caregiver remembering or writing down all these things. It enables the care manager to put it into their companion, and then the caregiver right now could refer to it against the checklist at any time they want. I have to believe that's very useful for both parties.
Extremely useful. And then with the chat function, let's say they do ask a specific question, then there is some responses prepared so that let's say the case manager's out at another visit, they will receive some type of information in that moment to support them. And all of our care managers really help ensure that each caregiver is supported because somebody's always there to respond.
My father's still alive. He's the person I care for. He turned 96 in April, but he can do things that some people with dementia, of course, couldn't possibly do.
Does he have any other physical challenges?
Yes, his challenges are all physical. Keeping him medically sound is seriously time consuming because my father has basically his meds and his pacemaker keep him alive, essentially. And of course, that brings up the whole question of are we really doing people a service by extending their lives? If I asked him, he would say absolutely. His walking is seriously compromised too. So, wherever we go, I take a wheelchair for him, which I have to load and unload and so on. As far as the technology goes, I appreciate being introduced to various apps and things. I appreciate that very much. And I also appreciated the home visit. I was delighted to see I know this sounds so ageist, but somebody who was maybe another generation that kind of understood a bit what was going on for me.
Adriana, okay, tell us about you.
Yeah, well, I'm a native Californian, born and raised in San Jose. There's 8 kids. I'm number 5. I never actually saw myself getting into aging at all. I am the supervising care manager. Initially, it was sort of part time doing actual care management with caregivers and then part time running the program. When somebody signs up and based on their answers, they'll get specific resources into their companion page. And, when we were testing it, I went through it like I was a caregiver and so simple to use and so easy. And that's something I really appreciated because, again, a busy caregiver doesn't want to deal with all of that rigmarole of having to log in and remember a password and all of that stuff. So it's really nice that you can just always go back because you get that text saying, here's the link to your personalized companion and you can just always go back to that message, that link. We have some people that will send them the web address so they can do it on their laptop because some people prefer that. Some people might want to print it out. All depends on their learning styles. And yeah, they can always just go back to it and it marks what you've read so you can, like, okay, this is where I left off. I'm going to start with these resources next. And anytime a care manager adds anything, you get an additional text saying your care manager added something to your companion so they can go and look and see those to-dos that we've added. And it's really simple just to click on that link and read what you need to read, skip things, go back to things. It's really nice to have it all in one place that you're not. We have that a lot. People tell us a lot, like, oh, I have papers all over the place. Just people have given me things and they're all over the place. This is all in one place.
It takes the stress off of them of being responsible for seeing what's new all the time and they don't know, right?
They definitely appreciate that we're not chasing after people. People aren't leaving us messages and then we're leaving them messages and we're leaving them messages and then they leave us a message but we miss it. And so, there's none of that phone tag. It's just the my plan enrollment form is coming in. It's coming into our shared email address. We can all see it and any escalations that might be coming in, any of our bi-directional escalations that come in, we all see it. And we know, okay, that's my client, that's your client. This person isn't working with anyone yet, so we'll take it on. And it just makes it so much easier to keep up, making sure people don't fall through the cracks with those phone tags and then somebody eventually gives up and that's a person who doesn't get any services, but far fewer people are falling through the cracks. Every once in a while, we'll get somebody who signs up and maybe they got what they needed in their companion. We could never reach them. But the vast majority of people, it's just really streamlines how they come in. And the care managers really like that it's there and the information is all there. It's all in the email. So we know the name of the care recipient, the things that they're dealing with, their age range, and it just saves a lot of time.
Well, things that my plan discovers through feedback or an answer. What's a few types of escalations that come in?
Yeah, the ones we notice the most are if they found a respite provider. That one is probably the one that comes in the most. And, interestingly, it's those ones that we haven't been able to connect with those people like person to person. So what I like about it is that then it gives us that like, oh, we can help you find a respite provider. So then we are able to connect with those people for that reason. That one and if their respite needs have been met. Those are two really important ones that really help us get some of those people that we haven't been able to reach.
The other thing that I got that I'm hoping to be using very soon is there's a respite planning artifact that I can utilize to determine what the respite. I haven't had a vacation since my father joined me a year and a half ago. I know that's important, and I'm not afraid to leave him, but I'm afraid to put him at risk.
They filled it out, they got their companion, they got their resources. Maybe they didn't schedule an appointment and we're trying to reach out to them to schedule an appointment. And it's just not working. So those bi-directional messages are helping us get even more of those people because we tell them, yes, we can help you. And they're like, okay, great, let's do this. And it's sort of a reinforcement of the things we do and the services we provide.
Yeah, I have an interesting thought. My plan's collecting longitudinally life factor data points on people socially, physically, mentally that have never, ever, ever been collected. So I don't, it's fascinating. I think at some point we should just, maybe we'll come out to Sourcewise and spend the day going back. Like there's probably some fascinating patterns, learnings that we all haven't taken the time, or maybe you do look at some of these things and adjust, because I could just see learning from some of that. Maybe we adjust what a care manager does in their motivational interviewing. Maybe we should publish something together on that.
I really appreciate the day, especially seeing that follow up and how it's changed because the kind of questions we ask, I've asked my whole career, but nobody's ever aggregated it, right? Nobody's ever looked and said, oh, this person has less stress now. This person hasn't fallen. And it's really gratifying when I run that report and I can see like our stress levels are down, our depression levels are down, falls have decreased, hospitalizations have decreased, and it's really fascinating and exciting to see. Like, we always think what we're doing is helping people, but this is actually showing us the data behind it.
A few of the current outcomes: a decrease in food insecurity, right? 17% decrease in transportation preventing access to care, 74% decrease in feeling of isolation, 35% decrease in depression, decrease in stress level, 81% of caregivers' need for respite care, 88% of caregivers' Medicare and Medi-Cal questions were addressed. To your whole point, that is fascinating data and information. And some of that we could use to tweak the messaging, the questions. Some of that we could use to tweak what your care managers do or say. The data could be fascinating, right?
I could probably guess what my caseload would look like, but I would never be able to guess what the whole agency caseload looks like. And I was really excited about the Medicare Medi-Cal because California had a lot of changes to eligibility and nobody thought they qualified. Now a lot more people qualify. It's just really gratifying to see these numbers because it really does show the impact. And that's just so exciting for me.
Bob, of all of those statistics, what hits hardest with me is that 74% of participants reported decrease in feelings of isolation. And we all know that a person's outlook directly impacts their overall physical and mental health. Thanks, Annalisa, Elizabeth, and Adriana. And we especially want to thank Jennifer for sharing her personal story of caregiving for her parents. Big learning from this session is that we are all at some stage in our lives caregiving for loved ones, and we're going to need help to do that successfully. On behalf of Bob Gold and myself, thank you for listening and learning more about this caregiver program that supports not only those in need of caregiving, but the caregivers themselves.